Facebook and YouTube Live here on a Thursday evening, coming to you from my home office here in the Twin Cities, here in Minnesota. And just want to know how you're doing with the school year. For many of you, it's starting. I hope you're doing well. You know, my hope today is to encourage you. I know that it's hard to get back in that groove, but I just want to thank all of you as educators for all you're doing to serve and to make a difference. It's kind of like sometimes with your own children as a parent, you wonder, is it making a difference? And I just want to say absolutely. And I'm just thankful to have this chance just to come to you live. And this recording lives forever on the internet. I have a YouTube channel, Think Like a Nurse, as well as a Facebook page, Keith RN, Think Like a Nurse. And these are archived there. So if you are unable to make it or want to send the link to a colleague, you know, I want to get the word out. And so the things that I'm sharing today are going to be really important. Tonight, we'll be talking about evaluation and evaluation of clinical judgment, writing test-based or case-based test questions. So stay tuned. And I just have a few minutes of intro I want to get started with. But if you don't know who I am, my name is Keith. I am the founder of Keith RN. And, you know, my passion and mission is to create innovative tools that bring practice realities into our classrooms and to our content and our curriculum. And so I've written literally over 100 plus clinical reasoning case studies based on my lens of clinical practice and things that I see in the large metropolitan hospital here where I've practiced in the past, and just want to let you be aware of that. But I also have a vision. And, you know, Pat Benner had a vision as well. She wrote 10 years ago in Educating Nurses, a call for radical transformation. And, you know, there's still needed change that as we look at nursing education, it's not all rainbows and butterflies. And I just want you to know that as you look at transformation, as we look at change, you know, I want to know basically, what are your thoughts as far as, you know, when you look at your program, your content, what struggles are you continuing to experience that really need to be addressed? And I'd love to know what your thoughts are, because my goal in this time tonight is to make this a dialogue, not so much just a monologue of sharing some of the things that I have, though I do have some good information. I want to hear from you. I want your questions, your insights. And so I want to start out with, who's out there tonight? I'd love to just, I got the chat wide open. I'd love to see who's there and who's got where you're coming from, and just love to connect with you. And if you have a thought on transformation of nursing education, because one of the things that I'd love to see in our generation is to see a paradigm where we're focusing on bringing practice, that we're preparing students for practice, and practice readiness really becomes a passion, that we really, you know, the NCLEX is important, evaluation, writing good test-based questions is important, but preparing students for practice is something that I think we sometimes lose sight of in the weeds of NCLEX and, you know, our pass rates and what are they. Very important. But if we implement educational best practices and the things that I'm sharing based on Benner's work and others, we can be a part of that needed change. And so just want to encourage us to all be a part of that. And it's my pleasure to kind of serve your needs and what we're doing here today. You know, we've been on a seven-part series. There have been 6 sessions that we've talked about that have preceded this. And I just want you to know that I have with YouTube, we have a YouTube channel, Think Like a Nurse, that where all of these live kind of in perpetuity. And we'll see, I've got, I'm just going to pop in the link to the clinical judgment playlist on YouTube. And I'd love you to just share some of these videos. They're only 4 to 5 minutes in length, so they're really concise, related to the Facebooks tend to be about 40 to 45 minutes in length. And so just want you to be aware that there is I've developed some shorter YouTubes that you can easily access. The link you can share. And again, go to your colleagues and let them know it's out there. And so it's just a pleasure to see some people out there. Carol, thank you for the shout out. Jasmine from Houston, Texas. Tanya, you've been here before, Tanya. That name looks familiar, from Oklahoma. Upgrading the curriculum and here to learn what needs to be done. Well, Tanya, I'll share my best, but I'm going to base everything I share on educational best practices and bringing practice into your content and curriculum. And Diane, you're welcome. Thank you for doing this. It's really my pleasure. And it's something that's one of the highlights. I do this every 2 weeks, and it's a pleasure to be here. Alicia from Ann Arbor, Michigan, and Teresa. One of her challenges she shares is this: helping clinical faculty to feel a connection to the curriculum. And Teresa, I would ask the question, do your clinical faculty have a connection to the faculty, to the leads that are teaching? Because it's really a relationship. I know when I was an adjunct clinical faculty, it was in essence kind of like I felt really disconnected from the faculty. And so if we're not connected to the faculty and have a relationship, not just kind of like a name and a number and an email address, but there's some connection, Teresa. So I would just ask that question, and please throw out any thoughts or comments that you have. And so, yeah, we've got Susan from Canton, New York. And Teresa says, yeah, it's a challenge for sure. And, I think that, as we look at even transforming nursing education, we can talk about clinical judgment and all that we need to do to think like a nurse, care like a nurse, all that goes with it. But, transformation of nursing education begins in our departments of nursing and the relationships that we have. And, when we look at how closely knit are we as a team of faculty? Do we really work well together? Do we enjoy and appreciate and value the diversity? Or is incivility and just that kind of like a disrespectful culture where you're devalued, disrespected, or differences aren't tolerated? I'm going to share some things tonight that are probably going to be things that may be very different, but I hope you can appreciate and consider the things that I share. And I think as individual faculty in your programs, I think it's really important that that we value that diversity, that we value each other. We're all different, but thank the Lord, we're not all the same. Thank the Lord, you're not all Keith RNs. We need differences. We need to balance out some of that intensity and just the differences that we all bring in the way that we're wired and created. It's all a good thing. And so anyways, just some thoughts just to consider. But, as we look at this journey, that playlist I want to commend you to, because I'm not going to spend a lot of time going back on what we've talked about the last 3 months. It's been every other week. So we've had 6 sessions on clinical judgment, and we've really gone deep on defining clinical judgment, looking at curricular frameworks to develop clinical judgment, why case studies are one of the best practice-based and research-based approaches to bring practice realities into your program was week 3. Week 4, we talked about clinical judgment in the classroom using infobesity, cutting our lectures and looking at making time for active learning. Then the clinical, asking the right questions and kind of probing those questions using Socratic questions and using clinical reasoning questions based on Tanner's framework and others. And then last time we talked about clinical judgment and simulation using case-based scenarios and what that looks like and ways that we can kind of double the amount of clinical reasoning using a clinical reasoning case study to kind of prepare the way. And then as a pre-briefing activity, and then letting that case study either be the continuity of simulation or use it as just a simple pre-briefing and a different emphasis or different patient for the sim. So again, all of those are on that YouTube channel that I shared earlier. And I also want you to know I've really been working hard on, as I look at just the needs to strengthen clinical judgment, to improve practice readiness in our students and preparing them for NCLEX and Next Gen. I realized that I wanted to do something a little different. And so what I've done, it'll be published in about the next 1 to 2 weeks. I just finished recording a 4-hour series on this entire sequence of developing clinical judgment as a course complete with contact hours. It's going to have 4 distinct parts that incorporate all 7 components. And I'm going to go into some additional details and a lot more information and more tools that are going to be shared as a part of this resource. And so I'll be talking about all of the things I just kind of highlighted and then some, as well as going deep on evaluation and writing test-based questions will also be kind of the last leg of that series that I'll highlight very briefly tonight. And so if you're a member of the all-inclusive membership that I've developed for educators, Think Like a Nurse, it's going to be at no cost. It'll be a part of your access. If you're not a member, no worries, you don't need to be. But there will be a charge less than $100, probably around a $99 price point, for the 4 hours of content and the tools that you can use and all that goes with it. So I just want you to know that, a lot of faculty really struggle to bring this active application of learning and infobesity. And I've been sharing these strategies, but I've been also developing additional content and additional tools that'll be a part of that course. So I'm really excited to bring the latest and the knowledge that I've gained in my dissertation studies and the research work that I've done on clinical judgment with my dissertation. So that's to come. Just want you to give you a heads up on that. And so tonight, we're going to be talking about writing next-gen style case-based questions to evaluate clinical judgment. So we've talked about developing clinical judgment for the last several weeks in this series. Now it's time to evaluate it. And that's basically when we come to, the written tests. And so when we look at this aspect, because our students, if you're in a 2-year program, your students that are going to start this fall semester will be taking Next Gen NCLEX in April of 2023. And they're going to see 3 case-based scenarios at a minimum with 6 questions apiece. And as we look at this, there's a lot of confusion, I think, about Next Gen. And we're going to talk about that a little bit and just some ways to maybe simplify it and not stress and overwhelm. But I'd love to get your thoughts in the chat. What is kind of what is the pulse for you personally as it relates to Next Gen, and just really looking at what's required? How stressed are you about Next Gen? What are your questions, your challenges about kind of how do we best develop clinical judgment using case-based scenarios? Or, what technology do we need to make it happen? Do we need to go with the 2-column, 3-column matrix and have all the complexity that the Next Gen will offer, and really stressing out about the technology, for example? I'd love to know kind of what is kind of out there in the audience tonight. And so if you've got a thought of just how you're feeling about Next Gen, I've got about a 30-second delay here. So I'd love to get your thoughts. I'll keep my eyes on the chat here, and I'd love your feedback. And so I would just, I'll answer anything that I see coming in live and take it from there. But what I'm going to do right now, I'm going to share my screen, and I'm going to basically kind of go into some aspects related to Next Gen. And I want to kind of show you some things a little bit differently to kind of see what is kind of in the secret sauce of Next Gen and what that looks like. And before I get started, I kind of saw a comment that I'm going to miss here from Tonya. She says, "I'm so excited to see this change. What scares me is making this into exam content." And, Tanya, I totally agree. I think that when we look at Next Gen, again, let's really kind of step back and say, really what Next Gen is forcing our hand as educators to do is to change, which we struggle to do. And I think that's why even the changes that Dr. Benner advocated 11 years ago in educating nurses, I think we're still struggling in so many fronts to see it realized for a number of different reasons. But you know what? Next Gen is forcing educators, forcing all of us to change. And that's a healthy thing. That's a good thing. And so now, my goal, to best serve your needs is to kind of say, okay, I want to keep it as simple as possible. And I look at things a little differently maybe than others. And so I'm going to share some strategies that will help you, I think, to more easily write Next Gen based questions. And so Alicia has a question or has a statement: how to best prepare our students for Next Gen and entry-level practice. And, you know, Alicia, a lot of the things that I've shared in some of the last, in this series, I've talked about some of those principles of just developing the clinical reasoning skills and using Tanner's framework and what that looks like. And Teresa says this, not stressing about the technology. The unfolding can happen with or without the technology. I think the students sharing with the subsequent cohorts will force us to change our test frequently. Yeah, I'll throw that out there, Teresa. I think you're totally right on. And I think that, you know, what I love about your comment, Teresa, is not to stress about the technology and the complexity of next gen. You know, if I could really give you one thing as educators to really take away from this time that you're spending with me tonight, and I value that and I appreciate it, is simply this, is that we must focus primarily on developing the clinical reasoning skills in our content, in our program. And we need to focus on not teaching to the test, not teaching to the next gen model even, but to be teaching to the processes of clinical reasoning that really, where, you know, as we look at nursing process, as well as Tanner's framework of clinical judgment, that we're teaching, for example, noticing skills. You know, noticing skills are recognizing what's relevant, what's important, what's concerning. Because again, you know, we're preparing students for practice. The clinical judgment is for practice, not necessarily for next gen. That's just the hoop that's just the hurdle they have to overcome. But again, recognizing relevance, for example, that's a clinical reasoning skill. Another skill that we need to practice and develop is that recognizing relationships, recognizing how clinical data is related to each other, or pattern recognition, as Tanner would call it. You know, those are skills that we need to practice in the clinical. And I've developed numerous tools and handouts that are inside the membership that you can use to help develop pattern recognition, or problem recognition is another skill. And so what I just want to encourage you with is to, as educators, focus on developing the clinical reasoning skills, using Tanner's framework as the foundation, using nursing process as a foundation. But we're developing the skills. And again, if we develop the skills, next gen will take care of itself. And so I just want you to kind of consider that. And let's look at, I'm going to share my screen here, and I hope that technology plays nicely with me. And we'll basically just, I'll go to this one right here. There we go. And kind of got a split screen here. But what I want to share with you are just some next gen type of questions. And what I want you to see is what they have in common. We're going to do some critical thinking. Compare and contrast. Because what I want you to see is a similarity of test questions, despite the complexity, despite the technology. I want you to look at them a little bit differently. So one of the, as we look at the next gen using case-based scenarios, a concise case scenario with a medical record that has limited data, we'll have, for example, vital signs, assessment, H&P, lab values, etc. Then they're going to have these innovative test item formats. But I want you to look at the technology, because Teresa had a very good insight, and it's recognizing that let's not focus on the technology. Let's look at the processes. But here, for example, is one of the item formats, the next gen, the close or drop down. Now, the close drop down, as you within each of these, you have a sentence, and then you have basically a drop down. And you're going to have 3 to 4 to 5 selections that are available, but only one is chosen. You know what that is? That is a multiple choice question. But in the drop-down close, it's a series of multiple choice. So kind of think of like multiple choice on steroids. In the traditional test items that we have as our foundation, I think in our programs, majority of our test items are single multiple choice. There is one stem, and then you've got the selections and multiple choice, and you choose out of the 4 or 5 responses the correct answer. Next Gen is taking it to a different level where now you're going to have 2 or 3, or in this example, 4 multiple choice are simply drop downs. It's just a different way of making the choice. And so what I want you to see is that the technology is kind of cool, but yet in essence, the drop down close is just a multiple choice that's got more than one multiple choice in that single question format. That's what makes it more complex. That's what makes it more challenging. But again, it's a multiple choice question. So let's go to the next one. The next one that'll be is called the hotspot or the highlighting, where you're going to have, for example, a clinical scenario. You're going to have a concise paragraph, and the students need to highlight in this question what findings require follow-up. I should also add they're going to have what they call a highlight table, which instead of having a paragraph, they're going to have a table beneath it. They're going to have a table of like 6 to 8 or 10 aspects from this scenario, and you're going to click each row and highlight the row. And in essence, when you look at the hotspot highlighting, a real cool format, all it really is, especially with the highlight table format, it's a select all that applies. You're looking at this scenario, what requires further follow-up? And they need to select this section, this one. No, that's not requiring follow-up. It's the same discrimination of select all that apply. And as you know, students hate select all that apply. They're the most difficult test item format, and they're difficult for a reason, because you can't kind of guess your way through it. You either know it or you don't. And so what I want you to see is that the highlight, it's a select all that apply. Let's go to the drag and drop format, where now you have steps for a procedure. This one is on intrauterine resuscitation, and you've got a series of 6 steps, and you need to bring which ones go over to appropriate steps. In that context, again, it's a select all that applies. Now we're going to get a little bit more complex with the multiple column matrix, where now you have pieces of data you're assessing after the client after an intrauterine resuscitation. For each finding, click to specify whether it indicates the intervention was effective, ineffective, or unrelated. And so in this context, what you have are just 6 pieces of data. You've got a temperature, fetal heart rate, etc. And you have to make a decision. Is each one of those either, which one of those is the correct for each level? Again, it's a multiple choice on steroids. It's a single select multiple choice, but it requires, in this case, 6 multiple choices. And so again, the complexity is there, but in essence, it's a multiple choice. They also have a different form of what they call a different matrix. That's a multiple response matrix, where you would have the ability to possibly select for each piece of data, not just one of the 3, but 2 of the 3, or all 3 may be relevant depending on what the question's asking. And again, and even the multiple response format, that is a select all that apply. When you look at the bow tie format, this is a real cool next-gen format. Again, pretty high-level technology where you have a scenario, review the medical records, and now you're in essence going to identify what's the problem the patient is likely experiencing, what actions to take on the far left, and what assessment parameters to monitor on the far right. It's really kind of a 3-in-1 question. When you look at the condition that they're most likely to experience, it's 4 selections, and you're basically bringing up only one. So it's a multiple choice, a single multiple choice for the first part. Then on the left-hand side, the actions to take, that's a select all that apply with 2 correct answers. The parameters to monitor, select all that apply with 2 correct answers. And so I'm sharing all this to kind of, in essence, I just wanted to, for those that are not familiar with Next Gen, I think most of us are by now, but really what I want you to see is that if you can write case-based questions that have a select all that apply or a multiple choice that has plausible distractors. You can by having a case-based scenario, medical records if you choose to on the side, and then basically use a series of select all that apply or multiple choice questions that sequentially follow the framework of the NCSBN and the 6 steps, or the 4 processes of Tanner, making open-ended questions that reflect each of those processes. You are, in essence, can capture case-based evaluation scenario questions that represent the essence of Next Gen. But you don't need the technology, because I am willing to bet that every one of your programs has the technology to deliver select all that apply or multiple choice questions. But I'm not going to make it quite that simple. I'm going to share some other aspects and some things that I think will help you in this journey of writing case-based questions, because now we've got to get down to some brass tacks, and now we've got to kind of just, make it real. And so the first thing, when you look at when I look at the 3 components, as you look at considering what I'd love to see us do in nursing education, is not only writing test-based questions that, in essence, we can put into our current framework. So we can, in essence, begin introducing case-based scenarios into our formative and summative written tests using select all that apply multiple choice options, because we can do that. You can also then, if you're using Canvas, Blackboard, or any other exam software with that format, you can also create an ancillary medical record or include the medical record data in the actual STEM itself. And so, you can decide to go as complex as you like, but if you want to be really faithful to Next Gen, the Next Gen is going to have a medical record component to it. They're going to have then the scenario, and then they have the questions. And so what I'm going to share with you is that when you look at case-based scenarios, one of the things that I've done with Keith RN, and I'm going to share one of my case studies on heart failure with you. I'm going to share a skinny reasoning. What I want to kind of show tonight is how you can take a simple case study like a skinny reasoning topic. If you've purchased one on Keith RN or you have access to the membership, how easy it is to basically kind of pull from that to create, in essence, either a separate medical records, or more importantly, you could even just use the case study itself, because the data there has the medical records built in. And so what I'd like to show you really quickly is, I'm just going to stop sharing this screen, and I'm going to share with you the case study itself. And so let me just go ahead and just find my share button here, and we will go ahead and share a different tab. And what I want you to see here, and hopefully we can, I'll go right here. And again, I'm just going to share I'm not going to go over this entire case study, but what I am going to do is, in essence, share with you just kind of the flow of a skinny reasoning, and how you can adapt this, how you could, in essence, change the data. Because one of the things that, as writing a case study in a well-written scenario is a lot of work. And so when you look at, the aspects of using case scenarios that are already out there, I went to attended a session, a webinar by Donna Iggy, and she talked about how, using the case studies that are out there, whether they be in your textbook, using those cases in the back of your textbook are a great place to start looking for scenarios. Other workbooks you have, if you're using any of the Keith RN resources, you're able to basically, you've got those initial scenarios that can form the basis of any type of case-based scenario using the content that you have. And what I want you to see here is essentially just the opening scenario. This is a heart failure patient, and you've got the opening scenario, you've got the social history. If you wanted to, you could create a separate medical record, and I'm going to share a link with you at the very end of this presentation from Wade Hollingsworth at Meridian Community College in Meridian, Mississippi, who was kind enough to share an Excel electronic medical record that they developed for simulation that they're no longer using, but it's very powerful. It has all the aspects of each component that you would need for a complete medical record in a well-designed and beautifully done Excel format. So you could either print that up, or you could use the actual, keep it electronic if you chose to. And so that link is on an Amazon S3 link. I just converted that tonight. I'll be sharing with that. I'll share that with you at the very end. So stay tuned. But I want you to see that this history and the social history, that could be the H&P. You know, that's really what Next Gen is doing. They're basically taking a scenario and they're kind of tagging that, I've noticed on their format, into a H&P type of format. So again, that introduction of a woman who came in with this problem. She's got heart failure. Her EF is 15%. She presents to the ER with shortness of breath, etc. So you have this opening scenario and you have the social history. And if you've noticed, you know, if the case studies that I've written, they have the vital signs already established and built in. And so in essence, if you wanted to have a separate medical record and wanted to really replicate Next Gen and have that kind of like a dedicated medical record, which I think is a great idea, use something that other people have developed, your own, or what I'll share with you with this Excel spreadsheet that you can use to develop your own kind of dedicated medical record and just adapt whatever works. And again, change some of the data here. You now have a nursing assessment that is built in. And so again, you have that aspect of the EMR as a part of the case study. You also have the rhythm strip. And then you have the lab values. So again, the diagnostic results. And so in essence, you really have the key components of the medical record content that will be used in Next Gen. It's just built into the case study. It's not separate. So it's really up to you as far as how you'd like to do that. And then with part two, what you have is now putting it all together with the clinical reasoning questions. And now this is where, I've kind of taken Tanner's framework and now kind of synthesizing, putting it all together. What's the problem? You have the medical management here with what the doctor has ordered, why would they order this, and the expected outcome. And so now you've got the problem that's present, and there could be more than one problem. There could actually be 2 or 3 plausible problems, and that's possible with any scenario. And I'm going to show you some test questions on how we can write those. And then you've got the medical management, and you've got, in essence, the 5 to 6 orders. Some of those are a priority, some of them are not. You then have the nursing plan of care, the nursing priority, and the priority interventions, and the rationale and expected outcomes, holistic care, and then educational and discharge priorities. In the unfolding reasoning, you have, in essence, the change of status, another set of data. 2 hours later, there's new information, and you start the process again. And so what I want to show you then here, I'm just going to reshare my screen. And what this looks like is, let me just, there we go. And we'll go back, we'll reshare. All right, and let me just do one quick thing. I want to get that message off there. Okay. There we go. Got that off. Awesome. So let me just make sure that I've got that we are back to where we need to be here. I'll just go here and let me just reshare. I think something's just got a little bit whacked here. All right. Here we go. Awesome. Okay. And so in essence, now, when you look at having the medical records, however you choose to do that, when you have the scenario, you now have the questions. And what I wanted to share with you is just, in essence, some of the questions. So like, for example, in this scenario that I developed, I want to I'm going to read it to you so you can kind of get a sense of just what a typical 2-paragraph H&P scenario looks like in the cases that I've written, or any others that you choose to use, and then the questions now that follow. And so let me share my scenario on heart failure. Joanne Smith is a 72-year-old woman who has a history of MI 4 years ago and systolic heart failure secondary to ischemic cardiomyopathy with a current EF of only 15%. She presents to the ED for shortness of breath the past 3 days. Her shortness of breath has progressed from shortness of breath with activity to shortness of breath at rest. The last 2 nights, she had to sleep in a recliner chair to rest comfortably upright. She's able to speak only in partial sentences and then has to take a breath when talking to the nurse. She has noted increased swelling in her lower legs and has gained 6 pounds in the last 3 days. And so what I want you to do is with these next series of questions, we're going to I've created a really simple template that in essence identifies there are numerous questions that 2 or 3 or 4 questions. If you look at the NCSBN with each of the steps, I just took what I saw was the most the sweet spot. And so, for example, the very first question, which is noticing in Tanner or recognizing cues, what data does the nurse need to notice that is clinically significant in this scenario? Select all that apply. And so, for example, you would simply then write a select all that apply multiple choice, and you would choose based on your scenario using what's relevant and clinically significant in your scenario. You're going to pull out no more than 9 because the NCSBN, the last time that Phil Dickinson presented at a conference that I attended, he says that the select all that apply, which is also a next gen format, is no more than 9. And so I would say if you're doing first year students, I would limit your select all that apply to 5 or 6. Don't overwhelm them at a max. If you have second year students, you should use at least 8 to 9 and go the full limit. Prepare them for that higher level complexity. So again, have a series of, however many you choose to do, have your plausible distractors written into the scenario, as well as that which is there. And for the cases that I've written, the answer key is included. And I've got exclusive topics, about 80 exclusive topics inside the membership that are not available for purchase. And so the answer key can really guide you and help you to decide what you choose to use and what's relevant and why in that scenario. Then the second question you want to use, and this is just a 3 selection multiple choice, interpreting relevant clinical data in this scenario, what 3 problems are possible? And so again, as you're interpreting the data, this is interpreting under Tanner's framework or analyzing cues of the NCSBN model. What are the reasons for this data? What's the possible problem that's present? And so again, you can make it 2 problems that are present, 3 problems, but again, it's in essence a select all that apply with a 2 or 3 that need to be selected. And so again, have plausible distractors, have plausible that are not clearly the problem. And again, you have your second question by using, in essence, that clinical reasoning question. The third question is interpreting relevant clinical data in this scenario. Which problem is most likely? And that's prioritizing hypotheses, which is, again, kind of takes Tanner's interpreting and just kind of builds on it. And so in essence, that's just a single multiple choice. You wanted your students to know, what's the problem? You got 3 possibles. Now what's the most likely? Single multiple choice. And again, the NCSBN may have a drop down. They may have other innovative formats. But again, we want to focus on developing the thinking that goes with that. Now, for the fourth question in your case-based scenario, you could use this as part of your exams. Generating solutions of the NCSBN framework says, based on the current problem, which orders would be anticipated by the nurse. Select all that apply. And so again, depending on your case-based scenario, if you use a Keith RN case or not, that medical management is right there. You can choose the top 3 or 4 and add 2 or 3 or 4 plausible distractors. And you have your next, 4th, select all that apply. But again, it's using the repetitive framework of the NCSBN or of Tanner's framework. The 5th question, which is responding in Tanner's or taking action in the NCSBN model, is what interventions are appropriate for the nurse to implement. And again, looking at what's the priority, what's the interventions that would follow that priority. You're just doing interventions. And again, identifying those essential interventions, doing 2 or 3 or 4 plausible distractors, and again, select all that apply. And finally, reflecting and evaluate outcomes. After implementing the plan of care, what findings indicate the client's conditioning is worsening, or it could also be improving? You choose. Have a set of data. This is we have to just write a very brief evaluation scenario with a set of vital signs. It could be that simple. And maybe 1 or 2 assessment items. And then a select all that apply that would indicate that the patient's condition is worsening or improving. And so as you look at that, I just want you to kind of consider just simplifying and giving you a framework and some guidance. And, the NCSBN has made a lot of their questions available on the internet. So if you go to, the Next Gen and the NCSBN website, you've got lots of information there that could, again, build on some of those questions you'd like to use. I just kind of kept it simple and just wanted to share kind of a concise framework of questions that you can use to basically kind of help you put it all together and have a concise scenario, medical records, and a consistent framework of clinical reasoning. But these questions that you use in your test questions, especially those that are using Tanner's framework, those questions also need to be used in your clinical. They need to be talked about in your classroom and simulation, because these clinical reasoning processes that we're developing that are foundational to develop the outcome of clinical judgment, that's what we're wanting to develop. And so let's not make these questions just test questions. Let's make sure we're taking the essence of Tanner's framework and we're bringing that into all that we do in nursing education, bringing that practice-based emphasis. And I just kind of want to highlight that as we look at Tanner's framework, remember that Tanner's framework is an evidence-based, research-based, practice-based framework and model of clinical judgment that is informed by practice. When Tanner did her synthesis of over 190 articles back in 2006 on the topic of clinical judgment. Remember this, the NCSBN model is a test model. It's an evaluation model only. It has not been validated to really inform practice of the bedside nurse. It is a test model meant to evaluate clinical judgment. And I think it's really important that we make a distinction. And I know a lot of there's some prominent educators who are advocating a completely different path, and I choose to disagree. But I think it's really important that we bring practice in a practice-based framework and model. And so I know that the NCSBN and Next Gen is a big deal, but let's remember we want to use those best tools and those frameworks that are developing clinical judgment based on what the literature of nursing has informed us with. And that's where Tanner's framework and nursing process continue to be highly relevant, and I think should be the foundation of the theoretical frameworks that guide how we teach and practice our profession. So anyways, that's just kind of my thoughts, but I'd love to know your thoughts. And so if you have anything to share, please, I'd love to get your feedback in the chat. I'm going to stop sharing here so I can kind of see what is in the chat here. But, I want you to know that I've got some resources that I'd love to share with you. And one of those is a free case study. So if you'd like to, I've got a free download on Keith RN. I'm just trying to copy and paste this link here. It's not cooperating with me here. I'll see what's, It's just being stubborn. It's not wanting to go there. Okay, whatever. Not going to happen today. But you know what? Just go to keithrn.com. And if you just scroll down about halfway through, you'll see free resources. Go to that link. There's your case study and what that looks like, and put that to good use. I also want to let you know I've got another resource that I want to share with you. That is I've got a faculty guide to clinical judgment that I've developed. And it's about 40 pages, but it's got a lot of content related to just everything that I've been sharing over the last several times that we've gotten together. And it's really taking the essence of what I've shared and I put it in writing and then some. So if you're a reader, if you like to just kind of have things that you can basically to mark up and to highlight and to reread, that's a really powerful resource. And there's the link that you have there. But before I go any further, I just want to kind of look at some of the feedback in the chat. And I want to answer your questions before we go on any further. And so let me just kind of throw some things out there. Teresa says this: I think helping the clinical settings understand that students are on the unit for academic mentoring, not just to help with staffing needs. Okay, Teresa, it's like, and I agree that we need to basically, when you look at that and what that looks like, I think that sometimes the expectations that they're there to help, but not to learn. And sometimes the students aren't always looking at are putting their needs first, and they're kind of putting their focus on. And so anyways, as we look at, Jasmine says this: I am using the documentation from students' clinical paperwork to create case studies and using your clinical reasoning questions. And, Jasmine, using the clinical setting to really just identify some of the great scenarios that you see. You can take the clinical setting is such a powerful place to get some of these scenarios that could be great case studies for your, not only for possible test questions in your content, but more importantly, bring it into your classroom, bring it into simulation, other contexts, post-conference. But those scenarios are priceless, Jasmine. I totally agree. And, using the same questions. You see, one of the things that I want you to know with my case studies, I use the same questions regardless of the case study topic, because the clinical reasoning processes that a nurse uses, that you use in practice, are the same, regardless of whether you're an OB, ICU, ER, PEDS. The way that a nurse thinks and reasons by noticing what is most important, for example, and then what is the interpretation or meaning of what's most important, never changes. Those principles are going to translate to any setting. That's why you can really be consistent with the clinical reasoning questions you can use with your test-based questions. And so Vuman says, Keith, can we get a copy of this PowerPoint that matches Tanner to the NCSBN model? Now, just simply say this, Vu, if you would like anything anything that I've shared tonight or have more questions or information, please just contact me by email. Just keith@keithrn.com, and I'd be glad to respond directly to that request or any other questions that educators have that I may not have adequately answered, or just something totally different that you just like more information to and what that looks like. And so, yes, and Tanya says this: I've been using your case studies a lot. My class is really liking them. I love to see their light bulbs go off. I can see clinical judgment in their decision-making within the case. And, Tanya, just an FYI, the cases that I've written basically came from the crucible of practice. I wrote the majority of the med-surg topics in Keith RN, the ICU topics, and they came straight from practice, things that I saw, things that I translated, things that I synthesized. And then I took the realities of what I saw in practice, and then I basically used Tanner's framework several years ago, 9 years ago, when I wrote my first generation of cases, using those open-ended questions of noticing, interpreting, responding, reflecting. And again, the next gen totally takes off of Tanner and uses, in essence, the same questions, just adds two more that additional steps. And so, yes, the cases can capture that reality and bring students into the clinical setting. And that's my goal. Let it unfold just kind of like it does in practice. And so I'm glad you find it helpful, Tanya. And thank you for sharing that. I also want you to know that I have a membership site for educators called Think Like a Nurse. If you're not yet a member, I'd encourage you to check it out. I have an informational page I just want to throw in the chat here, and just learn more information about the 110 different topics, different levels of complexity. So I have a skinny reasoning that I shared with you today. The unfolding reasoning is about twice as long with a change of status, additional complexity. So you kind of can level the case studies across the curriculum from simple to complex. First year students, second year students. This is just, again, another kind of distinction that's unique with the cases that I've written. So just want you to know that it's there for you. And if you're a member, I just want you to know that I've got office hours tomorrow morning from 10 a.m. to 12 noon. You'll get the link by email if you haven't already. And so if you have questions that you'd like to answer relating to what's coming up in the new year, I'm available, and I'll be there tomorrow morning from the 10 to 12 noon. I also promised you the template of those medical records. So I just found the link for that. And I want to, again, commend those to you. It's a free download, just an Amazon S3 link. Go ahead and take a look and download that and see if you could adapt that. It's totally editable. So again, you can take off tabs, you can modify it. Wade's done a wonderful job. And I just want to thank Wade and Meridian Community College for making that available to educators and gave me consent to do that and to share it with the world. So thanks so much. And, next week, 2 weeks, we'll be here again, and we'll basically be talking about practice-based nursing assessment. What do students really need to know? And so we're talking about how we can take head-to-toe assessment. What are the really essential skills that are practice essentials that we want to go deep on, kind of deep knowledge of the most important assessment skills? We'll identify them, talk about them, get your feedback on what you think is most important to practice, and take it from there. And so let me just kind of see what you've got there. And Carol says, yeah, I just saw it on your membership site today. It's pretty cool. I want you to know that I've got some additional next generation resources that are on the membership site, including the template of questions that I shared with you as a Word document, and many other new ones that are already posted or are coming, all with an emphasis of really practicing and developing the clinical judgment skills. So take a look if you're a member. And I want to thank you for joining me tonight, and I wish you the best. And I look forward to connecting with you in 2 weeks, and make it a great school year, and have a good night. Take care.